Good evening, everyone. Anna here from Rock Your Birth. I'm here tonight and I'm going to be joined really shortly by the lovely Layla Holmes from Physio Advantage. She is a musculoskeletal physiotherapist. She's an expert women's health physio, and she's going to be joining us to talk all things pelvic health during pregnancy.
So let's make sure the technology works for us. So it says that she's just joining. Oh, here goes. Here is Layla.
Hello. Nice to see you, Anna. Hello.
You.
Hello, everybody. Oh, thank you. That was a lovely introduction, Anna. Thank you.
Good. And there's quite a few people here that have joined us. We've got Kayla, we've got Bex, returning to yoga. We've got Sam Chandler. Oh, Sophie. Few people joining on. Oh, Ruth, the lovely Ruth.
Brilliant. Hi, Kayla. Mim. Anna, as you see the questions popping up, if there are questions that pop up, do feel free to, let me know as they come through. I have got a structure that I'm hoping to follow so I don't end up off on a tangent and I cover what I wanted to. But I am aware that I'd really like any specific questions to be addressed if possible, if that's okay. So shall I just introduce myself and what I do?
Yeah, go for it, Layla.
Yeah, thank you. So my name's Layla and I work at Physio Advantage, which is my physio company in Cofton Hackett. I'm a muscle and joint specialist physiotherapy, so I treat muscle and joint injuries, but I have a specialist interest in a specialism in women's health physiotherapy. So I've done my physiotherapy degree and then I've also done a master's in women's health physiotherapy. And that means that I can treat pelvic floor problems, physiotherapy for problems in pregnancy, pain during pregnancy, can give advice and guidance on exercise during pregnancy, and postnatal rehabilitation as well is something that I'm very passionate about. So when you've had your baby and we've gone through all of those muscle and joint changes, it's very important that we address those changes. Our bodies have been through such a lot, ladies. So I'm very passionate that we work with these trainers.
I think at some point later, it'd be great for us to do this again and talk about the postnatal period, because I know a lot of people on my page stay following my page even when they've had their babies. I think that's something that would probably be of great interest to people as well.
I think that's very, very important, because I think something that I really try and encourage that people see throughout my work and my posts is that once we've had a baby, we have always had that baby. Our bodies have changed, our minds have changed, our lives have changed, and it's important that we keep that support and we work with those changes, So today I wanted to ideally focus on the changes to the pelvis during pregnancy. And the idea of that being, ladies, is not that I'm going to be able to address any specific pains that you may have right now, but because ideally everybody, if you have a certain pain during pregnancy, it's addressed in a specific way, a personalised, individualised way. So you have your own individual treatment. No two pregnancies are the same. No two bodies are the same. We've not got two medical histories that are the same. So it's very important that treatment is always specific. So I'm not giving any specific advice for conditions at the moment. My purpose with today's session was to give a background as to what happens around the pelvis during pregnancy and how can we work with those changes during pregnancy to really empower us to feel more in control about those changes that are occurring in our bodies, and to ensure that we are minimising the stress and the strain throughout our pelvis and throughout our other joints. And that's what I feel very strongly about. A lot of the time I see women, and I think, when we do get pregnant, we do feel our bodies are changing, and it's very important that, we can feel that we can work with those changes and we understand them, because if we start to understand what's happening with our bodies, it puts that fear to one side, and then we can start feeling and managing things more comfortably. So that's the purpose, ladies. Okay, so ladies, where is the pelvis? I often take for granted some of the times, especially now I've been doing lots of telephone calls or video calls, and especially in the NHS, I've just tapped people on the phone and not been able to see them, and I say, put your hands on your pelvis. Well, I take for granted people know exactly where that is. So I thought we'd start off first of all, ladies, to get familiar with where our pelvis actually is and what are these bones and joints in the pelvis. So first of all, let's feel around the pelvis. So where is the pelvis? I think it's quite nice, ladies, to feel down from the waist. If we feel down from the waist and we come onto our big winged pelvic bones here. Now, the medical term, the physio term is your ilium, but we can call them our big winged pelvic bones because that's what they feel like. So we can work our way down from those bones, down, if you're comfortable, to feel the front of the pelvis, which is essentially the joint in between the legs. That's your symphysis pubis joint, ladies. This big, well-supported joint at the front of your pelvis. Our pelvis is a ring, and that's what I'm ideally trying to get you to feel now, how it works as a ring and works as a unit. So we've felt the front joint here, the symphysis pubis joint in between the legs. Then we work our way back around the top of the big pelvic bones, and let's feel around the back as we work around the top of those big pelvic bones, and then we come down, and then we might feel a little bit of the knobbly joints there, which is our sacroiliac joints, where our ilium, our tailbone, joins our sacrum, our tailbone joins our ilium and forms the sacroiliac joint either side, ladies, and that's these joints here. So there's our tailbone, and there are our pelvic bones, and these are the joints that make up our pelvis. Okay, so during pregnancy, the changes to these joints are very significant, and these are areas where you may feel discomfort, and you may feel some symptoms. So what's the role of the pelvis? So the role of the pelvis, it plays a massive part in transferring your body weight. So this is essentially the centre of our body, ladies. So when we're walking, it transfers our body weight from our trunk here down to our legs. So that's when we're walking. Then when we're sitting, it transfers our body weight from our trunk down to our bum. So during pregnancy, the first change that we can note with that role of transferring weight is naturally we get more weight in our pelvis. Our babies are growing here. So naturally our pelvis has a bigger role of supporting more weight during pregnancy. That's normal, that's natural, and that's very, very healthy. So I'll be going through how we can work with that change of the pelvis having to control and support more weight of your growing baby. Okay, another role of the pelvis is it's really important for muscle attachments. It's the centre of your body here. Lots of muscles attach at the front of it here, your abdominal muscles. And I think we can see, if we think very simply about how our bodies look during pregnancy, our bellies grow, ladies, because your baby is growing in your tummy. So the muscles here, our abdominal muscles, stretch. So the muscles at the front of the pelvis are stretching. Okay, so the muscle attachments here for the abdominal muscles are very, very important. And the fact that we have lengthening of the muscles at the front of the pelvis is very important. It's also very important to note that the pelvic floor at the bottom of the pelvis help to support our pelvic organs as well. So they support our bladder at the front, our bowel at the back, and our womb in the middle. So the role of the pelvis is to support our pelvic organs. It's to transfer our body weight as we're standing and as we're walking. It's important for muscle attachments, not just the abdominal muscles, ladies. And this is why the pelvis is key, really. We have lots of changes going on inside the pelvis during pregnancy, but it's very, very important that we recognise that the pelvis has attachments to above and below. So here are where your legs come out, where your hips come out, and it's very important that we recognise the pelvis has an important role in the muscular attachments of our glutes, our hip muscles here, our back muscles here, and our abdominal muscles here. So the altered muscle length around the pelvis is very important to acknowledge during pregnancy as well. Do you have any questions with that, first of all, Anna, before I go on to the next part?
No, I mean, you know that this is something that I'm really passionate about. So I did not think about this at all when I was pregnant the first time. I didn't really pay any attention to what was changing in my body, how I could support that. And then it was obviously the problems that I had postnatally that, you know, really made me realise, you know, like what an amazing but very huge job our body is doing. And I'm now like a massive advocate for, you know, empowering women and sharing with them that people like you exist, and that actually this is, you know, a really important factor that we have to take into consideration because we get one body. So I am finding this all really, really fascinating. Thank you.
Good. And please do feel free to interject with any questions, like I said, Anna, or if I'm not very clear with things, please do let me know. Okay.
Anybody else that's watching as well, if anybody that's here,
please do put some questions.
Shout them out and we will make sure we try and answer them.
Yeah, that's fabulous. And Anna, I really like the point that you made there with regards to the fact that you weren't necessarily very aware of issues or how your body changes or what an event your body goes through being pregnant and having a baby until maybe you feel the changes and discomfort or dysfunctions after you've had your baby, and then you recognise either because of pain or pelvic floor problems or tummy problems. Then you get to recognise what your body's been through. And sometimes I think that's quite useful because it's a warning sign for you to look after those changes. But what I think is key is trying to empower women before it gets to that stage. Absolutely. And during pregnancy, if you can empower yourself with understanding and knowing the changes that are going on around your pelvis, it can, and I think this links in very much to your fabulous work with preparing ladies for labour, in that understanding your body and understanding the changes and how it feels, how your body feels. One thing that I find very, very important with the changes that go on around the pelvis during pregnancy is we're very unfamiliar before we have our babies or before we get pregnant about pain or sensations around here, really. I was quite amazed at when I got discomfort in my pubic bone. Oh, I've never had that before. That doesn't feel very nice. I've never had pain in between my legs before. It's a very different sensation. And let's put our hands up. Who did their pelvic floor exercises before they were pregnant, ever? Who was ever aware of their pelvic floor exercises or their pelvic floor before anybody said, oh, you're pregnant, do your pelvic floor?
Hopefully all of my hypnobirthing mums are, because this is something that I talk about, absolutely. So if there's any of my hypnobirthing mums there, you better be saying that you're doing your pelvic floor exercises.
Absolutely. So with the pelvic floor, with the pelvis, we've got to realise that we have all these changes going on around the pelvis. We've got the muscular changes. So first of all, as I've mentioned, your abdominal muscles attached to the front of the pelvis, they stretch as your baby grows. We've also got the extra weight of your baby in your pelvic floor growing, and that stretches your pelvic floor. Now, what happens with a stretched muscle is there's naturally less stiffness or tension in that muscle. So naturally, if there's less tension or stiffness in a structure, there's less support from it, okay? And that's okay, that's normal, that's natural, but let's be aware of that. Our pelvis has less muscular support and control during pregnancy due to those stretched muscles. We're also aware, I think, a lot about the hormonal changes during pregnancy, the altered levels of relaxin, progesterone, estrogen affect the ligaments around the pelvis. The ligaments around the pelvis, let's just make sure we're aware, are very, very strong, okay? And will support your pelvis, but they do relax because your pelvis needs to be able to accommodate your growing baby. But again, I often take for granted, what are ligaments? You know, I say the word ligaments, but why should we all know what ligaments are? Okay, so ligaments are structures that keep joints nice and steady and in place. So they're collagenous structures, and those hormonal changes during pregnancy act on those structures and relax them. So your symphysis pubis joint at the front in between your legs here has a very, very sturdy disc there to keep it nice and stable and steady, and also lovely ligaments to help keep it nice and stable and steady. These relax during pregnancy, but they are still very, very well controlled and supported. And the same during the back, around the back, sorry, here. We have the tailbone as it joins the pelvic bone, and these are your sacroiliac joints. These are held together by very, very strong ligaments, so they are fibrous structures that support the joints. Those fibrous structures, which we call ligaments, relax due to the hormonal changes that occur during pregnancy. So we've got two quite significant factors there. Normally our pelvis is well looked after with good stabilizing control from our muscle stiffness and tone and strength, and our ligaments. Both of those change during pregnancy, but we must remember your body can support these changes as well. Okay, so with those changes, what can occur? Now normally when we're not pregnant, very, very little the joints in the pelvis. So the pelvis, as I've mentioned, is this pelvic ring with the symphysis pubis joint and the sacroiliac joints at the back. Now, ladies, whilst I mentioned those joints, those three joints in the pelvis, the symphysis pubis joint and the two sacroiliac joints at the back, I just want to highlight as well, often people say, I've got SPD, but then somebody said I've got pelvic girdle pain. And what I just wanted to highlight is we used to call pain maybe just in the groin, the pubic area during pregnancy, symphysis pubis dysfunction. So this joint is the symphysis pubis, and dysfunction is when you have pain there, altered movement there. Now we know very much so, as I got you to feel your pelvis, it works as a ring. It all works in unison to help control the body weight from side to side and transfer your body weight. So if you have pain, clicking, discomfort in your pubic bone area, for example, you are likely to have altered function around these joints as well, whether it be extra stiffness or extra mobility there or muscle tension, because it all works as a unit. If these are moving awkwardly, you will have altered torsion and rotation around here too. So that's why we deal with the whole pelvic ring, okay? So just to mention that. So what I wanted to just make sure we were aware of as well is that you can also, due to that, just get pain on one side. A lot of ladies come and see me and they say, why have I just got pain on the right side though? I don't get it. If it's my whole pelvis, why is it my right side? That's because we can quite easily, if I undo these screws of the pelvis, I reluctantly undo the screws though, ladies, because my pelvis does quite easily fall apart if I do this. But you can see that can start to just rotate a little bit more, and we get extra torsion through that side. But this side doesn't necessarily have to work that way. So we can get altered function one side and not the other. So that can give us discomfort on that side, but not necessarily the other side, because the pelvis has a very, very important role in transferring the weight from one side to the other. And that's why sometimes you may get more discomfort when you're on one leg, going up and down the stairs, or walking. So I'm just going to read this question, but I might carry on my flow and get back to it. Let's see. I've had SPD my last 2 pregnancies, and I've had crutches from 30 weeks. Do you have a specific question with that, my dear? And let me know, because absolutely, crutches can be given for symphysis pubis dysfunction, or like I mentioned, we tend to call it pelvic girdle pain now, to help with that very important role we've discussed that the pelvis is involved with, which is weight transfer. It helps transfer the weight from one leg to the other, and from the tummy down to the legs. Okay, will it cause a sciatica type pain? I'm a lot older now and only 23 and can feel the pain already, so hoping to learn how to avoid the time. Lovely question, Becky. Sorry, clicked too early. I do that all the time. I click far too early, Becky, always. So I will come back to it though, if you don't mind. I often get asked that question, and it's often a big fear with women. You may have had pelvic girdle pain in a previous pregnancy, and then you notice, I'm getting it earlier now. Why is that? Okay, so earlier pelvic girdle pain, it simply, you've had a baby before as well, is very important to recognise. Your body has had those muscles stretched before. You've had those ligament changes before. You have had those gentle sprains and strains through the joints in the pelvis before. And if you've had pelvic girdle pain previously, you are more predisposed to have it in future pregnancies, but it doesn't mean it's not manageable, and it doesn't mean it needs to be debilitating, and it doesn't necessarily mean you'll need crutches again. If it does though, it's okay. It's helping the function of your pelvis, which is fine. Some of us, we need to accept, are more predisposed to getting pains around the pelvis, and there are a few predisposing factors of that. You may be hypermobile, which essentially means that your collagen, so your protein structures that make up your ligaments, are more stretchy, and you're more stretchy through your muscles as well. So you've naturally got less support. I'm quite stretchy. So that can mean you've naturally got less of a support system. Again, if you've had more babies, you are more predisposed to having pelvic girdle pain. If you've had heavy babies, or if you're heavier, that can make you more predisposed to pains and strains around the pelvis. You may feel it earlier in your pregnancy, the next pregnancy, because your body's been through those changes, and especially if you haven't necessarily had any specific rehabilitation of your body after your pregnancies. Everybody's pregnancy, labour and body is different. Nobody needs exactly the same postnatal rehab as the next person. So it's very important to get those individual symptoms addressed, whether it be your posture changes, any stiffness that needs to be addressed, any stretching or specific strengthening that you need to do is very, very important. The important thing to value is you can do a lot about preventing and managing sprains and strains around the pelvis. So I've mentioned why and so if I go into those details now, Becky, and ask me any more questions about that if I don't cover what you need to. And being an older mum, it's absolutely fine. You can still rock this. You know, so what we need to make sure we're aware of is, we've discussed the natural control around the pelvis is less during pregnancy. Again, just to recap, we've got the muscular changes, they're stretched, your tummy, your pelvic floor, and the muscle length around the pelvis is all changed. And also, your ligaments are relaxing because of your hormonal changes. So those two factors in themselves mean there's less natural control. So what do we need to do during pregnancy to help manage that? The key thing we need to think about, ladies, is alignment and positioning. So as best possible, we need to position our pelvis so we have the right load, strain and pressure going down through the joints of the pelvis. Now, what you might notice, before I go into how you can help control the position and alignment of your pelvis, that as your baby grows, we adopt a very, very common pregnancy posture, because the weight of your baby brings you naturally forward. Your abdominal muscles are lengthened. You have a more of what we call a lordosis, a dip in the lower back, which can cause a little bit of strain in the lower back as well, ladies. So what we need to be aware of is that naturally the pelvis is starting to tilt forwards a little bit, lifting the tailbone, arching the back. So naturally, we've got muscular changes and our body weight's bringing us there as well. So let's start controlling that. Let's help feel that we are aware of how we need to position the pelvis. So ladies, this should be safe for you all to join in with, but I'm going to get you to hold on to your pelvis again. Let's feel the pelvis and feel where we can move it. So the first thing that we can do to help our pelvic alignment, our pelvic control, and therefore help reduce strain and sprains around the pelvic girdle, but also ensure we are loading the muscles around the pelvis well, therefore getting good glute and hip activation, yeah, is our pelvic positioning and pelvic tilts. What I'll do, ladies, is I will go through this and then I will post the post that I've done on pelvic tilts and the video I've done of pelvic tilts on my story, so you can have a look at it. It's also on my YouTube channel, Physio Advantage, and it's such a useful and very simple thing to do once you get the knack of it. Pelvic tilts can be a little bit awkward to begin with, so don't worry if you feel strange doing it first of all. But what I often do, and I hope you don't mind, is just show you a bit of where your tummy is, where your pelvis is. I've had a big dinner, my jeans are very high. But if we feel the pelvis, so let's come down from the waist, feel those winged pelvic bones, beautiful. Now what we need to be aware of is that our pelvis can turn forwards and it can turn back. And these are the movements that we're particularly keen on controlling at the moment with during pregnancy. As you can see, as I'm tilting my pelvis, it's changing the position of my spine, it's changing the length of my abdomen and how I'm able to activate my abdominal muscles, which we know naturally are being lengthened during pregnancy, but we want to still be able to generate some healthy tension through those muscles to give us that support. So ladies, to start off with, just try and get familiar with tilting your pelvis. First of all, if you want to try and standing, just relax the knees a little bit, relax the knees, and always try, if you can, position your legs like train tracks. Can you see me all right, Anna, or do you need me to move a little bit?
That's fine.
Yeah.
Yeah, good where you are. Yeah.
Yeah, good. So if you tilt your pelvis forward, what you're doing is you're lifting the tailbone. Yeah, and then as you tuck the tailbone under, you're shortening your abdominals and you're reducing that strain on the joints in the lower back. And what's beautiful to do is every time you stand, try and just loosen up the lower back. Try and warm up some tension gently through the abdominal muscles and the pelvic floor. Then find the middle position of those tilts, and that's ideally how we want to try and stand a little bit more. So naturally your pelvis will want to make you do that during pregnancy as baby grows, and you're really lifting the tailbone. That puts a lot of strain down through the symphysis pubis, a lot of pressure down through those sacroiliac joints. Let's relax the knees and let's get familiar with moving the pelvis. You might find that you're swaying a little bit to begin with. Just get used to where is your pelvis and how does it move. And it's that turning motion we're looking at to begin with. Turning the bucket of water and the water coming out forwards, turning it back and the water going backwards is sometimes a nice analogy to try and get that movement. And then stay in that middle position. And in that middle position, we are loading the pelvis in the most ideal way to reduce any stress and strains down through the symphysis pubis joint and through the sacroiliac joints. What we're also doing is positioning the spine well and positioning the muscles well. Sorry, Anna, what were you saying, darling?
I remember when I had some postnatal physio and when I've been to see you as well, when you kind of go into that more neutral spine that isn't necessarily natural to most of us, because we are in very much, I've carried on maintaining that overarched, and I did a lot of dancing, which that was kind of the position.
Yeah.
I just wanted to sort of say, it can feel quite unnatural when you find that neutral and you try and maintain it. It takes a while for that to become like your new way of standing. And
your new way, absolutely. And that's why it's nice to practice lots and lots, because then it does become second nature. Your brain learns that muscle memory and that movement pattern. And it's also really nice to do other exercises that help encourage those positions as well. And so it's important we try and do that in sitting as well, ladies, because whilst in standing, you'll notice our bump brings us forwards like that. As you're sitting, you'll notice you sit around your bump tendon, we tend to, and that makes us very much the other way, very rounded. So we've got too much stress on the back in that rounded, flexed position. Our tummy muscles can't do very much because they're squashed, and there's lots of pressure going down through the pelvic floor and through the pelvis because we've shortened the space here. So it's got lots and lots of pressure and lots of weight going down through it. So in sitting, it's very important to do those tilts as well. Find that middle position and try and sit in that position. And that means that your muscles are in a better length and tension to be able to support you. And ladies, be kind to yourself. Sit with a rolled up towel or a pillow or a cushion behind you to help you. You don't have to try and sit there yourself in that position, okay? Support yourself with a cylindrical cushion is often very nice because it helps maintain that arch and you can't flatten back into it still, okay? So pelvic tilts are key. And what you might find if you're experiencing pain around the pelvis or lower back during pregnancy, as the pelvis is involved in weight transfer from sitting to standing, you may find you get more discomfort going from sitting to standing. So it's very, very useful to be able to practice some of your tilts going from sitting to standing, because it loosens up the pelvis, because you'll notice you'll get stiffer during pregnancy if you're still. And again, that's often due to that ligament support through our joints. So if you do 6 tilts before you come to stand, then arch the back and come to stand. That can help to alleviate that strain on the back and the pelvis, rather than you may be able to relate to this sort of way of standing up. Yeah. Which just means that we're not using our thigh muscles very well to stand up. We're not using a very good spine position to stand up. And it can potentially cause a lot of twisting strain through the pelvis. So whilst it's very simple movements that we're discussing, it's very, very useful and important to keep that good alignment and control through the pelvis, through sitting, through standing, and through sitting to standing. So I'll put that video on my story so you can see, but also feel free to look at that on my YouTube channel or my posts. It's a really, really nice resource for you to be able to see, because it's quite, like Anna said, it's a very strange thing to try and get to grips of, moving your pelvis. But combined with that is making sure that we're aware of the position of our lower body, because sometimes in order to keep good control and good stability around our pelvis when we're pregnant, and you might notice you do this as well, ladies, is you lock the knees back. We lock the knees back and we sway forwards to give ourselves a bit of stability. Our body's trying to help us out, essentially. But what's happening there is your knees will be taking quite a lot of strain. So what we need to try and do is keep strong through the legs, keep the knees slightly relaxed, and get our control from our centre, from the pelvis, okay? And in that gentle position, we can close and lift through our pelvic floor and then up to the abdominal muscles. Again, ladies, I'm not going to go into anything specific about activating our pelvic floor muscles or our lower abdominals as such this evening, because it's quite a specific thing to be able to do. And it's very important that we breathe well, position well, and that it's done on a very sort of one-to-one level, or we spend the whole IG live talking about it. I'd prefer if we're talking about pelvic floor activation. So being aware of the 3 openings down below and closing through your pelvic floor while you're in pelvic neutral. It's a gentle squeeze and a lift, ladies. Be aware of those 3 openings down below, and we are closing them from the back passage, vagina to the urethra, and pulling up to the belly button from the back to the front, a squeeze and a lift, okay? So pelvic tilts, knee position. They are very, very important in alignment, so reducing sprains and strains down around the pelvis during pregnancy. Supporting your back in sitting is very important, and supporting your back and positioning when you're in bed is very important. You don't have to wait till you get pain turning in bed to position yourself beautifully in bed. I love padding myself out with pillows and my duvet when I'm lying. It's so nice to support your pelvis. Let's enjoy it even before, we don't have to feel any sprains or strains before we support our pelvis. But what's the best way to do this? Often ladies say, well, I put a pillow in between my legs, but it doesn't seem to really help. Now, sometimes if we put a pillow in between our legs, it doesn't necessarily help. And I'm just going to move you a bit further down and hope that you can see my legs a little bit better. If we just have a pillow in between the top of the legs here, the lower legs can still angle in together, which creates still a little bit of rotation around the hips, which potentially causes a little bit of torsion around those joints that we know are a little less supported. So ideally, if we're going to get a pillow or cushions in between the legs, let's get them in between our legs, so it's in between the top of the legs and in between the bottom of the legs, and it keeps our legs like train tracks. So sometimes one cushion or one pillow isn't necessarily enough, because my legs can still squash that and I'm still angled in a little bit. Whereas if I had two, I'm likely to be a little more parallel and supported. So pillows all the way down the leg tends to be really nice and supported. Then say if I'm on my side, a pillow underneath the bump, because again, bumps weight pushing down can cause a twisting force around that pelvis that we know is a little less controlled. So if it's got that pull all night, you're likely to be stiffer in the morning, or even if you're there for a few hours. So let's support bump and let's support our upper body. So again, yeah, pillows, we can never get too many pillows in pregnancy or after having a baby. So let's just go for it. So another pillow here, so we're not twisting, yeah? So we've got a good support, we're cuddling, we're so well supported, and you can let go into that position and enjoy it. Is really, really key, ladies. And like I said, before you get any symptoms, it's lovely to do that. You don't have to wait till you get symptoms. So positioning in lying is really, really lovely as well. So also, so just to recap, we've got pelvic tilts for good alignment of your pelvis in sitting, standing, and going from sitting to standing. Look after your lower body position when you're standing. Try and keep your legs parallel so you can work your hip muscles well. Keep less strain through the knees and move the pelvis well. So keep your knees slightly relaxed so you can work your thigh muscles well. Support your back in sitting so you're not having to, not getting tired and doing this too much and causing lots of pressure through the pelvis. And support yourself in lying. Also, ladies, address any specific sprains or strains you might feel. We shouldn't have to put up with pains during pregnancy just because you're pregnant. We are, when we're pregnant, we do have these changes, but they are, we can still get other muscle and joint injuries which can still be addressed, and we can also very, very effectively address back pain, pelvic pain, thoracic pain. Any discomfort during pregnancy can be addressed. It's very important it's done on an individualised basis. And also, ladies, it's really, really important we try and keep as strong and conditioned during pregnancy as you're comfortable with. Every pregnancy is different. You know, my two pregnancies were quite different, really. I managed to stay fit and active, but my second one I found a lot more tiring than my first one. So just to say, ladies, it's very important that we try and keep well conditioned. So if you need advice on how to exercise during pregnancy, please do get in touch with a women's health specialist physiotherapist for guidance on safe and effective exercise. So you can either get in touch with me, or there are lots of good women's health physiotherapists out there. So I hope you found that helpful. Have I addressed, we had a little bit of a question of, can it cause sciatic pain, Anna? Can I answer that? Do you mind?
It was, who was it? It was Sam. She said, will this cause a sciatica type of pain? I think that was going back to when you were talking about the pelvic girdle. So
yeah,
whether it could cause those kind of sensations, I guess.
Yeah, now that's a lovely question, because it brings me on to highlight actually the fact that yes, it can, absolutely, Sam. And why is that? Because the role and the position of the pelvis is very close. Hi, Holly, so lovely to see you. I bet you've missed your favourite rock tape, haven't you? Okay, anyway, let's go back onto the position of your lower back during pregnancy. This is your lumbar spine. So your lower back is here and your spine is like building blocks up here. When we have the altered position of our pelvis during pregnancy, we tend to want to tilt and lean forwards. That alters the load and position of the lumbar spine vertebrae and positioning. So what can happen there is you can get a little bit of irritation of the structures in the lower back. And those structures can be muscular, because there are muscles around the lower back, can be disc, because there are discs cushioning the joints in the lower back. They can be ligaments, which I've explained are those structures that support our joints. And it can also be nerves. And nerves pass out in between the vertebrae and pass, the sciatic nerve passes down the back of the body here. So if we've got a little bit of a stiffness here in the very lower part of the back, and an altered loading, which occurs with altered positioning and less support around the pelvis during pregnancy, it has the potential to irritate those nerve structures. The sciatic nerve is a bunch of those nerves that passes through the hip to supply the leg, and if it's being irritated in the back, can give you that leg pain. That's horrible. So the positioning to take the load off that lower back is so important. So offloading that extra strain and pressure that's being put there by that altered position of the pelvis is vital. Trying to get some good muscle activation around there to support the area is really important. And getting some specific advice would be great. And as we're starting to do hands-on treatment, manual therapy is so beautiful for it as well. Mobilizing any stiff areas in your back, and we can do this during pregnancy, working into any tight muscle structures around the pelvis, working into activating any muscles that particularly need to be woken up a little bit and strengthened. So absolutely, pelvic girdle pain, sciatica and low back pain can be very, very much related. Yeah, and that leg pain can be very common. The sciatic nerve supplies the whole of the leg. I knew I shouldn't mess with these little nuts and bolts. I cannot find this one anymore. Never mind, this side of the pelvis is probably going to fall off in a minute. But that's why the sciatic nerve supplies the whole leg. So you can get pain a little bit down the leg or all the way down to the foot. And sciatica is irritation of that sciatic nerve. And irritation of the nerve can give you pain. And because the nerve supplies sensation, if it's irritated a little bit more, it can give you pins and needles because it's not necessarily passing its messages on too well. Then if it's a bit more compressed, it can give you numbness and weakness in the leg. And those are symptoms that really ideally need to be addressed. So please do contact a women's health physio. We can still do a lot during video calls, and like I said, a lot of us are starting to do face-to-face appointments quite soon. So do get in touch. Sam, I hope that's helped you, darling, and if you want some specific advice for your situation, please do get in touch, because it would probably be very, very useful. But yeah, and Holly, thank you for sharing it. Absolutely. With that and that leg pain, Holly's saying that she gets that leg pain. Oh, I'm glad, Sam. Thank you. Any other questions, please do ask. It is quite common to have this leg pain even when you're not pregnancy. And even when you're not pregnancy, that's what I do when I'm trying to read and talk. I can't do it. I can't multitask like that, never mind. So even when you're not pregnant, you can still get sciatic symptoms, and postpartum, those symptoms need to be addressed as well to enable those symptoms to fully be rehabilitated. Is that all right, Anna? Have I covered everything okay, darling?
Absolutely amazing. I mean, I love finding out more all the time, and it, like I say, it's something that I'm very passionate about after having my own struggles post both times. So I do always share with my hypnobirthing couples, the mums especially, about the importance of safe exercise. I don't give any advice, but I just say, look, it's something you need to think about. And obviously I always share your services with people. I just hope empowered, inspired people, that, you know, there is so much that we don't just put up with all of this now during pregnancy or when our baby's here. You know, there's out there for us to address these things. We shouldn't be uncomfortable. We shouldn't have dysfunction in certain areas. So I'm hoping that this is really opening up those communication channels and those, you know, so that people are aware that this is something that be looked after. So I
God.
don't know if you want to
Thank you.
how it is that people can find you, what specialists, you know, talk, perhaps just let them know about the Mummy MOT maybe quickly, just how people can find you, because that's something
Yeah,
that
absolutely.
I rave about, Layla.
Absolutely. Yeah, I was going to get this. So, my clinic is based in Cofton Hackett, and like I mentioned, I am doing video calls at the moment due to the coronavirus situation. But from the 1st of July, I'm looking to see people face to face again, and I offer pregnancy physiotherapy to address any pains and strains during pregnancy, advice and exercise programs during pregnancy.
And I guess any pelvic floor dysfunction during pregnancy as well, that's something that you could help with.
Yeah, absolutely, Anna, and thank you for highlighting that, because again, I think sometimes I take for granted that, you know, everybody is aware what physiotherapy during pregnancy is, and we're not, and I need to be, you know, be aware of that more. But absolutely, so any pelvic floor problems, the pelvic floor being the muscles underneath us that support the bottom of our pelvis, that control when we wee, when we poo, and our sexual function. So if we leak, when we cough, sneeze, if we get urgency, if we get any heaviness in the pelvic floor, it's really important that is addressed. And it's really important to engage with your pelvic floor and know how to activate the pelvic floor. We know that 1/3 of women don't contract their pelvic floor correctly, and that's very, 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 very common. And I remember when I first started doing my women's health training, and it was a physiotherapy course, and a lot of us physios weren't necessarily doing it correctly. So, you know, so that's really important. Oh, thank you, Kayla. So physiotherapy during pregnancy for any muscle and joint pains, any pelvic floor pains, any pelvic pain, any pelvic girdle pain, hands-on treatment. Yes, we will start this, thank goodness. I also offer pregnancy massage, which is
lovely.
Just beautiful. I was explaining it to one of my colleagues today, and I just love doing pregnancy and postnatal massages. It's just wonderful. So that's a really, really gorgeous time for you to really calm down those stress and anxiety hormones that are going wild during pregnancy and after having a baby. And it just feels lovely to be in tune with every part of your body. Then also Anna was asking me just to highlight about the Mummy MOT. Thanks, Holly, that's lovely. And the Mummy MOT is a specialist postnatal assessment. And ladies, please don't underestimate the changes that are going on in your body when you're pregnant, and that it's such a big event for your body to go through. I've talked about the muscles and joints more today. I haven't mentioned about the cardiovascular changes and all the other system changes that are going on as well. It's a massive endurance event. So please be kind to yourself with accepting that we need rehabilitation after we have our children, to address muscle changes, to address aches and pains after pregnancy. But even if you don't feel any necessary symptoms after having a baby, being aware your body has been through that. So let's guide it back on the path to function and strengthen it up in a graded way. We wouldn't go through that amount of stretching of any other muscle group during any other event or injury and not have rehabilitation. If you had stretched your biceps or strained your biceps, you wouldn't go straight into lifting straight away. So with our pelvic floor, without strengthening and stretching it in a graded manner, same with the pelvic floor and tummy muscles, it's important that we grade them back to the lifting, we grade them back to the impact we want to put back through them. We don't just put that load through muscles that have been stretched and weakened and have potential trauma and scar tissue. So a Mummy MOT will go through addressing your specific needs with regard to the histories of your pregnancies, any muscle and joint sprains and strains you've had in the past, the history of how you've delivered your babies, any pelvic floor problems you might be experiencing, or tummy problems, or concerns about these areas anyway. Sometimes we might just feel vulnerable in these areas, but not necessarily have specific dysfunctions, and that's okay. everybody essentially deserves a postnatal assessment who's had a baby, whether you have pain or not.
I
Yeah.
absolutely agree. I don't think, and I say this in my courses when I briefly talk about it, we shouldn't only do it if we've got a problem, because sometimes there is things that are going on, aren't there, behind the scenes that we're not necessarily aware of, and then we can cause further damage if we're not working in the right way, exercising in the right way, doing the right thing to protect the body. So I think, yeah, and in other countries this is like the norm, isn't it? In some countries there is rehabilitation expected and given to all women, so we're a bit behind in this country as far as that's concerned. So obviously it's great that there are people like you, but obviously it takes people to make that move, to decide that they are going to nurture, protect and look after them.
Yeah, absolutely. And again, it's really important to make women, explain to women, what exactly a mommy MOT is and what exactly postnatal rehabilitation is and why we need that. And making that link is so important. Ruth, I am coming to your question, darling. How soon after your birth do you recommend having a mommy MOT? But just to say, from Anna's point, in the lady Maria Elliott who founded the mommy MOT, she used to work in France, and it's in France they are slick with their postnatal rehab. You get home visits, you get rest. Pardon, what's that word? Hey, rest. I like that word, and I think we need to give each of us a little bit more after having a baby. Yeah. And in different cultures they're a lot better at giving a bit of TLC after you have birth. And after you have birth, after you give birth. Right, let me answer Ruth's question, because I can't string a sentence together right now. So Ruth, ideally we sort of allow 6 weeks of recovery after you've had your baby to then come for your mommy MOT, so that you've had sort of your medical check with your consultant, your GP as well, to say that you're medically fit. I know that the GP or consultant check may be very, very brief and not be very focused on you, but that tends to be what we say. It doesn't mean you can't start doing things before that 6-week mark, Ruth, like the pelvic tilts positioning, breathing well, gently activating your pelvic floor as you feel comfortable. What I find is very helpful is when I see ladies who are pregnant, and then I give them that advice and guidance for those 6 weeks, and often call me, whether it be a phone call or a video call, and I can go through things with you then. But I know you've been in tune with your pelvic tilting, pelvic positioning, your breathing control and pelvic floor exercises from seeing you in pregnancy. So you can do things before that 6-week mark, but at 6 weeks we can do hands-on. And if you want to, your mommy MOT can involve an internal pelvic floor assessment. So feeling the pelvic floor muscles and how they function is really, really valuable, because with any muscle function, it's good to be able to see it and good to be able to feel how it's functioning. Same with the pelvic floor. And then I'll assess your tummy muscles, so feel the general tone throughout the tummy, and then feel the tension through the linear alba, the tension in the connective tissue in the tummy, any spine stiffness you have, any stiffness around your hips. And we'll talk about your specific goals and needs to get back to a certain level of function or exercise. Okay. Ruth, is it too late to start? Absolutely not. 39 weeks pregnant. Oh, brilliant. Is your due date next week? That's exciting. No, it's never too late at all. If you wanted to, go through some things, beautiful positioning, exercises, strengthening, breathing with pelvic floor awareness, activation and release work, it would be great. And we could do that in the next few days. For example, if you wanted to, we could do it over a video call. It would be lovely. And it just, again, will probably reinforce if you've she has done. Have you seen Ruth, Anna?
Ruth, have I seen her? Yeah, Ruth's one of my lovely mums. Yeah.
I thought maybe. So yeah, it would work really, really quite well with the preparation that Anna's given you. If we can, work on the control, positioning of the pelvis, activation of your gentle activation of your lower abdominals and your pelvic floor muscles, along with your breathing control, being really in tune with those areas to help the birthing process is fabulous. And yeah, we can start doing some lovely exercises that suit you, bearing in mind knowing what you've done throughout your whole pregnancy and taking that into account, Ruth. So do get in touch. I'm at Physio Advantage on Instagram, Layla Holmes, Physio Advantage. Thanks, Ruth. Be lovely to hear from you. www.physioadvantage.co.uk or layla.holmes@physioadvantage.co.uk. I'll put my flyers up on my story now on Instagram, so all my details will be on there as well. My phone number, I'll include my phone numbers on the flyer too. Feel free to WhatsApp me, text me if that's easier, or call me. Yeah, I do like a nice chat. So do call. It's often, and then you can get that feedback straight away, which is often, get that 5 minutes in between what you're doing and give me a call. That would be great. If I can't answer, I'll get in touch as soon as possible. So any of those means of contact is absolutely fine. Facebook Physio Advantage, Instagram Physio Advantage, layla.holmes@physioadvantage.co.uk. My phone number. Yeah, I think that's about it, Anna. But yeah,
I'll share your details as well. Obviously,
oh, thank you.
My pages too. But thank you so much, Layla. The work that you do is amazing. It's lovely to be able to refer people to you locally. And it's something that I'm very passionate about. And in fact, one of my current hypnobirthing mums privately messaged me after the last session when I talked about it, and I think she had a mummy MOT with her previous pregnancy with a different practitioner, but said, I'm so glad that you raised this awareness because nobody talks about this antenatally and it's so important. So I will always be talking about this, not giving advice, I'm not a physio, but telling people where to go and why it's important that they do this.
And that's lovely, and what I really value is that working together and knowing our boundaries with it, and what each other specialises in, because I love doing breathing control and awareness of the body during pregnancy and awareness of the pelvic floor with breathing control. But you're the birth preparation expert, man. So I know, and blimey, do I get such positive reports about you. It's so lovely. I love it. And again, thank you, because the support you give to ladies is just fabulous. And what I've really felt has been so important during lockdown is that we really keep the messages out there that we're not alone.
Definitely. There are, services out there.
The support's there, and we all understand and your situations, and we can help.
Yeah, definitely. Yeah, it's important for people to never feel alone. That's in the antenatal period, but in the postnatal period as well, when we become perhaps sometimes a little bit more vulnerable. So yeah, absolutely. Well, thank you so much, Layla. Thank you to everyone that's joined us as well.
Oh, no, thank you.
Lots of people watching. Layla, I've now got to figure out how to save it. So do I press end?
No, don't worry. Yeah. So if you press end, it will say, oh, would you like to save this Instagram live? Would you like to post it? So if you do either, really, if you save it, it will go somewhere that hopefully you'll be able to see it. Or if you post it, it will be on your page posted, and then hopefully I'll be able to put it through my regram, and then I'll be able to have it as well.
Yeah,
so don't panic, babes. Press end. It'll give you a few options. And then don't worry if you don't save it. It's all right, darling. It's okay. I lost all of the one I did last night. It was so informative about prolapse. Doesn't matter. I'll do it again next week.
Okay. Well, thank you so much, Layla. Thank you to everyone.
Thank you for having me. Thank you for having me. And please let me come again, and we'll talk Mummy MOT, shall we?
Well, let's definitely do that. Yeah, thank you. Brilliant. Well, have a good evening, Layla. Everybody else, have a good evening too, and we'll speak to you.
Thanks for joining us. Thank you for joining us. Bye-bye. Bye-bye.